call it natural medicine. And the difference between osteopathy and allopathy, or modern medicine, allopathy, is I want you to think of medicine without the pharmaceuticals, without the industrialized pharmaceuticals and surgery. So if you've done the pharmaceuticals, you've done everything you possibly can, you've done the surgeries, or you want to avoid pharmaceuticals and surgeries, then you come to a person like me. So that's what I'm practicing, is trying to answer, find the source of the illness, find the source of the dysfunction in a system of systems approach, holistically look at the body. But if you're trying to figure out what's botanical medicine, what's osteopathy, think of medicine without a pharmaceutical. We would do it with plants, food, nutrition, natural compounds, and we would do it with exercise, mobility, but we would try to do it without surgery and without like toxic levels of medication. And then if that didn't work and you needed acute care, then I'm in behind supporting. So when you have some pretty severe protocols that are highly toxic, like say, for example, you have to do chemotherapy and you have no choice. Well, there's going to be a lot of payment, a lot of cost when that happens. And we would look to nutrients, botanicals, vitamins, and minerals. So that's what I was really excited to have today, an opportunity to express natural medicine without any negativity to modern medicine. That's not hopefully what this discussion will be. It will be in terms of we've got modern medicine and it saves lives. And anyone that bad mouths modern medicine, they don't know what they're talking about, because people's lives are saved every day, all the time.
So you're not
Oh,
looking at it as an either or. You're looking as these two approaches as complementing each other.
absolutely. Yes. Yes. And, but what I'm also looking for is, see, on the side of, like, it's different for me in the clinic I work. I'm in an environment where I have been embraced by allopathic medicine, by people that are prescribing pharmaceuticals, that are directing surgeries, but they want me involved, right? But where normally that's not the environment. So it's always like, in my opinion, a one-way street where I'm like embracing all forms of treatment and medicine, to get the end result, which is someone, keep them alive, keep them vibrant, keep them healthy, keep them going on. Whereas it's not really reciprocated, where we're kind of on the edge. We're still on the edge, where I'm getting severe cases that I literally fix with a vitamin or mineral, or movement. Like, at sometimes it's just not rocket science. It's really straightforward chemistry, biology. And that's what's occurred now. More and more, I have been delving very deeply in what we call orthomolecular therapy, in which you take a compound or multiple compounds that are essential to the body, like, say, magnesium, and not following the daily value that's been assigned, but to actually use doses, meaningful doses that the body actually needs, not just to survive, but to absolutely thrive. And then all of a sudden you see the illness or diagnosis change, disappears magically. And so a lot of times I can see that it's just a matter of deficiency.